a research fellow in the Justice Health Group, and I'm going to be talking today about a project we've been running around the custodial healthcare standards that are legislated in Australia. So this is our team here, and let's get into it. Sorry. I'd also like to start by acknowledging the traditional custodians of the lands on which we're all on today. For me, that's the Wurundjeri people of the Kulin Nation. And that's where my work's been undertaken. This is just a photo from up the road from where I do a lot of my work, where I go for runs in between work and meetings. This is obviously a relatively recently scarred tree, but it marks an area where we can still see eel traps that predate colonial settlement. So just like a reminder that Aboriginal people have been living on and taking care of the lands on which we live for many, many thousands of years. So I'm going to be talking about custodial healthcare standards today. It's a bit of a work in progress, but I'm going to first start by talking about healthcare governance in custodial settings. And so the prevailing consensus is that custodial healthcare should be the responsibility of the Department of Health, or the department that's responsible for the broader health of the nation or of the state, state or territory. As opposed to the responsibility of the Department of Justice or Corrections, or whoever is responsible for the operation and security of the prison or youth detention centre. There's a few reasons for this that I'll get into a bit later. But at first, sort of like to show what the landscape looks like in Australia. This is my attempt at mapping it. And I know that, a lot of you probably work in these jurisdictions, and there may be some inaccuracies here, which I take full responsibility for. But I think if there are errors, it shows that this sort of information is not very transparent. It's very hard to find through publicly accessible documents. But anyway, you can see that there are vastly different arrangements across Australia, and not every state or territory has custodial healthcare as the responsibility of the health ministry or health department. This table actually probably makes a lot of states look more similar than they actually are in practice. So, for example, New South Wales and Queensland, the responsibility for prison healthcare lies with their health departments, but that care is provided in much different ways. So in New South Wales, you've got the statutory body, Justice Health Forensic Mental Health Network, providing that care, whereas in Queensland, it's the hospital and health service where the prison or youth detention physically sits, geographically sits. I'm going to leave this up for a little bit while I talk about, I guess there's a significant push at the moment for increased leadership, governance, responsibility and delivery of care in prisons and youth detention facilities by Aboriginal organisations. And simultaneously, there's a push for states who do not already have the responsibility for healthcare with the Department of Health to transfer that responsibility. So the NOUS Group report, the National Review of First Nations Healthcare in Prisons, some of their longer term recommendations were about transferring justice health responsibilities to health departments, and to connect custodial and public health systems to support continuity of care. VACHO in Victoria has, echoed both of these calls, and the RACGP in its submission to the Youth Justice Senate inquiry has also recommended that departments of health have that responsibility. So there's a few reasons for this. I guess one of the main reasons is that theoretically it should support the principle of equivalence, is in that people deprived of their liberty should have the same standards of healthcare that are available in the community. And it can do so through, integrating that care with the public health system, supporting continuity of care, avoiding role conflict for health practitioners, and supporting clinical independence for people who may otherwise be employed by, the same department that runs prison or youth detention facility operations. I guess that principle of equivalence I put up there is a bit of a simplistic take on what is a set of relatively complicated international rules and legal instruments that have gone through many iterations. And I should say that this work that I'm going to talk about today is, a bit of a work in progress. And I'm not a human rights lawyer, although we do have a couple of amazing human rights lawyers on the team. So I am myself still getting my head around a lot of this stuff. But so this is a bit of a timeline of some of the relevant legal instruments and rules relevant to adults and children deprived of their liberty. So adults, the bar starts pretty low in 1955, where, basically there should be at least one qualified medical officer. All the way to 2015, where the Mandela rules state that prisoners should enjoy the same standards of healthcare that are available in the community. Going down to children, unfortunately, it's a bit of a lower bar. So if we look at start in 1989 there with the Convention on the Rights of the Child, all children have the right to the enjoyment of the highest attainable standard of health and to the facilities for treatment of illness and rehabilitation of health. The following year, the Havana rules came out, which are the rules for the protection of juveniles deprived of their liberty, which stated that children in detention should have a right to adequate medical care, so arguably a lower bar than what adults have under the Mandela rules. And in 2019, the UN Committee on the Rights of the Child clarified that children in juvenile detention should have a right to adequate physical and mental care, and then talks about how it should be provided by the facilities in the community, but still obviously arguably a lower bar than what adults have. Which is disappointing because the same year the UN Global Study on Children Deprived of Liberty came out and recommended that community equivalence. Now, there's a ton of other international treaties, conventions, etc., that are relevant to healthcare in Australian custodial settings. I won't go through them all now, but there are some of the major ones which have some relevance, but we could probably talk for weeks about, unpacking all of these. So as I said, I'm not a human rights lawyer, and I probably came into this project a bit naively, thinking that, great, Australia has ratified many of these, conventions, international legal instruments. And so, that should mean something, and, Australia needs to abide by those. But, here's a quote from the High Court, which essentially says that, unless these obligations are also incorporated into legislation in Australia, then they're not part of Australian law. But obviously they can help in the interpretation of legislation in Australia. So I guess the logical link from there is to look at what is actually legislated in Australia and how well these align with Australia's human rights obligations. Before I get to the current project, there's also, there are some national standards that are relevant. Here are a few. So we've got Australasian Youth Justice Administrators, National Standards for Youth Justice in Australia. Relatively vague on healthcare. It doesn't, they don't say too much. They say that services should meet health standards, but don't specify what those standards are. The Corrective Services Administrators Council, their guiding principle for adult corrections, talks about community equivalence. I guess these are guiding principles, though. Previous iterations were, promoted as minimum standards, but they're now, aspirational documents. For AYJA and the Corrective Services Administrators Council, these are also organisations made up of representatives from corrections and from youth justice, where, as I showed earlier, those departments or agencies don't actually have the responsibility for healthcare in those facilities. And of course, these are just the not enforceable documents. And the RACGP also has standards for healthcare in Australian prisons. Again, not not enforceable. They do talk about community equivalent, and they also get to, which I didn't mention before, they also get to, equitable care, which for people going into prisons and into youth detention facilities who often have higher health needs than the general population, equivalent care may not be sufficient, and it's equitable care we should be looking to aiming for. So the current project, we aimed to collate all current legislation and subordinate legislation, so that's the rules and regulations coming out of those acts relevant to healthcare in Australian custodial settings. We aim to then identify all the references to requirements or standards for healthcare within that legislation, and then analyse these against human rights obligations and best practices. We started by looking at all Commonwealth, state, territory legislation websites, and actually we had a different search strategy that didn't work initially, so this is the one we landed on. We searched those websites and looked for the relevant sections. So our search strategy, we initially searched all the legislation websites, as I said, for records with health, medical treatment or care in them, and that produced just under 8,700 results. So quite a few. We then screened the short title for words like police, prison, corrections, youth justice, detention, and so on, which got rid of the majority of those documents. I should say, so today I'll be talking about adult prisons and youth detention and some preliminary results from those, but the full project is also looking at police cells and forensic mental health facilities. And I also keep saying we screen these. I should say that a ton of this work was done by Rachana Rajan on our team, and Wahid Raza, and also Tess Kelly. That section got rid of most of the results. We then looked at the long title, objective, purpose section to see whether it was relevant to custodial settings. We ended up with 233 documents. And then we had to look at each section we'd extracted that contained those initial words around health, medical treatment or care to see if they were relevant for what we were looking at. So, for example, we'd find, sections where it was around magistrate court fees and talked about people with healthcare cards. So obviously not relevant. So we'd take out those sort of sections, which left us with 46 pieces of legislation and 156 sections or subsections that were relevant. I then went through and coded each jurisdiction on their overall legislated standard. So, a jurisdiction would be coded as tier 1 if the legislation said that there should be there should be equivalent care. equivalent to the community. Tier 2 was whether healthcare met the needs of people in care or supported or promoted their health. Tier 3, where it was just about maintaining current health. Tier 4 was where healthcare was required, but no standard was specified. And Tier 5 was where there was no healthcare required in the legislation we identified. And so what this looks like in practice, so for the ACT, this is, for youth detention, for ACT would see that they're coded as Tier 1. They have a very clear standard of healthcare equivalent to that available to other people in the ACT. New South Wales talks about the promotion of healthcare, promotion of health and wellbeing, so that's Tier 2. The NT just talks about the preservation of health, so Tier 3, and South Australia talks, really the only thing we could find was that, young people couldn't be deprived of medical attention. So it speaks to a requirement for care, but not a standard attached to that. And so mapping it across Australia, as you see, we just saw in the last slide, ACT has that equivalence. The rest of the East Coast talks about meeting needs or supporting or promoting health. The NT, talks about the preservation of health. South Australia has no standard attached. And from the legislation we looked at, WA didn't seem to have any requirement for healthcare in youth detention at all. The only mention of healthcare in WA youth detention that we could find was around the need for transferring a young person to another facility if the care they required couldn't be provided where they currently were. If we look at adult prisons, there's a bit of a change. So states aren't consistent across the settings. The ACT is, and the ACT has pretty similar legislation in both the Children and Young People's Act and the Corrections Management Act. Northern Territory also has a provision for equivalent care in adult prisons, not in youth justice though. We see Queensland stays at the same tier. The rest of the East Coast has gone down a tier just to preventing deterioration. Western Australia has care required but no standard attached, and South Australia didn't appear to have any requirement in the legislation we looked at. So going back to the ACT, this is their youth detention legislation, the relevant section we were looking at. And for adults in the Corrections Management Act, it's worded very similarly. I just wanted to show this because although they have that overall, section about equivalent care, there's also other things that get mentioned here, which are also part of some of the international rules and obligations around, preventative care, health checks, the frequency of care, timeliness, transfer to other facilities. And the reason that, well, my understanding of why this legislation is much more aligned to the human rights obligations than many other states is that the ACT has a Human Rights Act which predates the introduction of this legislation and the adult legislation. So when these acts were brought to the Legislative Assembly, they needed to demonstrate how they were aligned with ACT's Human Rights Act. So I also went through and coded some of these other things which I thought were relevant. So things, for example, in the Havana rules, so those rules around juveniles deprived of their liberty, they state that medical assessments immediately upon admission are a right. You can see in youth detention, though, only 3 out of the 8 jurisdictions require that. Less in adult prisons. Preventative care outside of an initial health assessment, only 1 out of the 8 jurisdictions required that, and that was the ACT. Frequency of care, hardly mentioned or required. Timeliness is also quite low. And unfortunately, First Nations specific care or culturally appropriate care, although it was mentioned quite a bit in youth detention legislation, was only required in 3 out of 8 states, 3 out of 8 jurisdictions, and was not required in any of the adult prison legislation that we identified. So a bit of a summary of what we found. So, I mean, there was quite Australia clearly doesn't have a set of uniform legislation. But it was interesting to see some states have, wording almost exactly the same across the different states. The ACT and the NT were the only jurisdictions which had requirements for equivalent care. And as you saw, this wasn't the case, though, for Northern Territory's youth justice, which is, I mean, it's pretty grim, and it's also grim because that, I guess, as we saw, the international rules do set a lower bar for children, so it is actually consistent with, what's seen in the international legal instruments. We saw there were like 5 of the states in the adult settings had the overall level of care of just preserving current health or lower. And we saw that SA and WA both had settings where no care seemed to be legislated at all. And then, of course, culturally appropriate care or care specific to First Nations people was barely legislated in adult settings, only required in 3 out of the 8 youth 3 out of the 8 jurisdictions for youth justice, which is, quite disgraceful when we have 37% of the adult prison population being First Nations, and that's over the whole country. So we obviously have states and territories which have a much higher proportion than that. Just some conclusions. So, I mean, before I get to a couple of conclusions, just wanted to shout out these 2 papers because the conclusions, I guess, align with a lot of what was said in these 2. So work by Gabrielle Wolf, and she has another article as well that's very relevant. Talks about this particular article there, looks at New South Wales, ACT, and Victorian legislation and healthcare across those, and then Tilipan, Naren, and Co's perspective piece in MJA has some very relevant recommendations towards the end. So I think the overarching conclusion is that, most jurisdictions need to have a higher standard legislated. It should be, I guess, qualified that, we're assuming that a higher standard legislated will result in better care, which may not be the case. And some of that work by Gabrielle Wolf, I guess, suggests that the ACT may not be seeing better healthcare than states like New South Wales or Victoria. And so to, I guess, combat that, one of the things we should be doing, and this was suggested by Gabrielle Wolf, so I don't want to take credit for it, is that legislation should be amended so that it's easier for people in prisons or youth detention to initiate legal action against the government if their rights have been infringed, and that there should be additional amendments to make the government more accountable to bodies such as custodial inspectors, ombudsmen, coroners, health complaints commissioners, and so on. And just a couple of limitations. I mean, we only looked at legislation, and it's an important point to make because obviously Western Australia does provide some level of care to people in youth justice. We just couldn't see that in the legislation. So, a next step is probably looking at policies, government strategies, models of care, contracts, health practitioner regulations, and so on. And then, as I said before, we didn't actually look at whether the quality of healthcare changes based on the standard that's legislated across settings. Just going to leave that there and happy to take any questions if I can work out how to stop sharing. Cool.
Brilliant work, Darcy. Thank you so much for the presentation. I'm sure
No worries.
collating all this information has not been easy. So now we have some time for questions. Please feel free to open your camera. It's always nice to see everyone. And also feel free to use the chat for any comments or questions you might also have. Louise, please.
Sorry, I just had a bit of a mouse problem there. I did wonder, are you thinking, I was just thinking, of course, as you do, about other things that might attach to this sort of piece nicely, and I was wondering if you'd had any appetite to maybe look at, say, coronial records about that deal with deaths in custody, say, and look at where they're related, what the correlation is with, say, problems relating to the governance of healthcare. And because I feels like that might be a nice, interesting kind of module to try and look at one way of seeing the impacts potentially. I know it's not going to be scientific because, coronial inquests aren't, they take different forms, I guess, and there's different levels of focus on them. But it might be an interesting way to look at some of the effects of the governance gaps or the governance positives.
Yeah, I think I've thought a little bit about it, sort of just trying to keep this project contained because it, could be huge. But yeah, no, in terms of this specific project, we did consider looking at, coronial findings and looking at whether any weight is given to, you know, any set of standards. So I think there are findings in Victoria where you see I can't remember the exact name, someone can chime in, but the Justice Health Quality Framework that's used, like that is talked about quite a bit in some of the coronial findings and the standards applied to that. So that was one idea we had that, maybe we can sort of look at what weight is given in these findings to different types of standards. But of course, we could also extend it out to see what's talked about in terms of governance. Sort of trying to keep this one contained so that we can actually get something out at the moment. Yeah.
Absolutely. Yeah.
Thank you. We have a question from Stuart in the chat. Fantastic work, Darcy and team. It seems that legislation is inadequate in most settings, although, of course, the actual quality of care could be higher. In your view, why is the legislation so important?
I think without the legislation, you can't really keep the government to account. As I guess concluded at the end, it needs to both have a higher standard included in the legislation, but also more, I guess, means for enforcement. So ways to keep the government accountable. I think they're both critical. Without it, it's very hard to actually get any action. And then, of course, like as I went through before, how the, different standards around the country, like the AYJA standards or the RACGP standards, or even just, the policies and documents, policies, etc., government policies around the country, they're not really enforceable. They're not something that someone in prison can, initiate action against for receiving inadequate healthcare.
Thanks, Darcy. Just thinking how important it is to do this work and collate all this information. I'm sure a lot of organizations and researchers will find this very helpful to provide this context to how their work is being conducted across different places. I have a question in relation to given how fragmented and different the systems are, were you surprised by any of the findings?
I was surprised that I couldn't find any requirement for care in WA youth detention and South Australia adult corrections, and I like triple checked it, and I really hope I haven't missed anything. But yeah, I just could not find it anywhere, and it was really surprising to me. I'm wondering if with South Australia at least, because South Australia Department of Justice or the Department of Corrections or whoever doesn't have responsibility for healthcare in that state. I wonder if, a broader public health, the requirements are contained in a broader Public Health Act, which we've missed, but we'll, definitely check that before we publish anything formally. They're probably my major surprises. Also, NT having a provision for equivalent care for adults and not for youth justice was a bit surprising to me as well. It seems like I can see states being consistently having low bars, but that seems like a deliberate choice to have a higher bar for one set of people and a lower bar for another set, or it's just an oversight if I'm being generous. But yeah, they were my major surprises, I would say.
Yeah, thank you. Thomas, do you have a question?
Yes, Darcy, great talking. Really important work. Apologies I came late, but I was wondering if there was anything in any of the legislations in relation to reporting, or I'm guessing it's a no. But just in terms of I guess the next step in keeping the government, I guess, accountable.
Yeah, I can't remember exactly. I mean, there were a lot of sections. There were some sections where I think the sections around, having independent visitors and some sections around reporting, I think did occur in some states, but we excluded them just because we need to keep this project contained because it was blowing out very quickly. So we tried to keep it around just like standards, and even with that, it keeps sort of spreading further and further
Yeah,
out.
yeah.
Yeah. But so there is, I think from memory, there is a little bit, but yeah, we didn't look at it in this.
Yeah, I totally understand. It can expand very quickly, and you can
Yeah.
never get it done. So no, great
Yeah.
work. Thank
I
you.
mean, yeah, this was initially meant to be a very quick project, and it's I soon learned that it's not that
As
case.
many of them do.
Yeah.
Great. I see we have a few comments and questions in the chat, but I'm going to hand over now to Alex.
Hey, yeah, really amazing talk, Jaxie. Sorry, I joined late too, but I was just wondering, in terms of when all this legislation was passed, like you might have covered this, but like what sort of years was all the legislation passed? And I guess with the sample of eight, it's hard to see time trends, but do you think there were any time trends or anything like that?
Um, I actually don't have the dates on the top of my head. It's also hard to know. Well, I mean, we can go back and check. But obviously, the date attached to the act, like for example, the Children and Young People's Act 2008 may have gone through many amendments since then. So varies across jurisdictions, and yeah, I don't have an answer. I think maybe what's relevant, I don't know if you were there for that part of the talk where like the ACT's legislation came in later than their Human Rights Act. So this legislation had to, had to align with their Human Rights Act. So that was quite relevant. Yeah, sorry, unfortunately, I don't have the dates on the top of my head, but that is something that might be useful to look at around dates and amendments to acts, etc.
Thank you. Yeah, no, it'd be intriguing when it's try and work out, I guess, the levers we can pull to influence future governments to institute that
Yeah.
SG.
Yeah.
Thank you, Alex. Madeleine in chat was asking whether legislation impact is related to whether prison healthcare is delivered privately or publicly, and I believe this was information that the project was able to collect. Is that right, Darcy?
Sorry, where's the question would be?
Would be interesting to understand whether each jurisdiction respective legislation impacts whether or not prison healthcare is delivered privately or publicly. Is there a pattern that you were able to observe?
I mean, I think the legislation does impact that. I mean, although I talked about, I guess, the delivery and stuff, that's not really what our project was looking at. But I mean, there's provisions in there, I think the way it's worded in the Northern Territory is, the chief executive must make arrangements for healthcare. And I think the way that that's been interpreted is that, they have then gone out and contracted Northern Territory Health to deliver that. It's a very confusing landscape. So my understanding is, Queensland, the legislation, puts it on the, Queensland Corrective Services, but there's a memorandum of understanding between QCS and Queensland Health, which the responsibility now falls with Queensland Health. A similar sort of thing happens in Tasmania, where there's a letter of intent between Department of Justice and Department of Health in Tasmania. So admittedly, this is not my area, and I think I need a lawyer. As someone, I feel like Louise may, have a greater understanding of this sort of area. But it's all very confusing, and it's all very hard to find this information too. So that letter of intent that I just spoke about in Tasmania only seems to be publicly available because it was an exhibit in a royal commission. If it weren't for that, it seems like, the public would just not have access to it at all. And same goes for many of these sort of arrangements that occur between departments and providers.
Thanks, Darcy. And by the way, Louise, feel free to jump in at any time if you have anything to add.
Thanks, Gustavo. Yeah, I see this at least one person here from OIC, so they may have a view as well. But something I believe to be the case is that in WA at least, when private prisons were first being introduced, there was some concern about what that might mean for standards of care. And so there was, as I understand it, that was one of the instigators for OICs being set up. And also there was some quite stringent requirements around the reporting of provisions of care in relation by private prison operators as part of the arrangement to establish the private prisons. And so I think in WA, my understanding, and I'm sure there's people who have a better understanding of what the current situation is than I do, but I understand that at least anecdotally, seems to be delivering greater transparency and potentially a higher standard of care in private prisons because that more stringent level of accountability was set up in the establishment stage. But I'd love to know if that's what other people think to be the case. While I'm talking, I was also thinking about your about the gap in WA for care for young people, and I was wondering in relation to kids who are wards of the state in the care of the Department of Communities. It may be that because the department has stands in the place of the parent, that has legislative requirements under I think it's the Children and Communities Act, something like that. Children and Community Services Act, maybe. So it may well be that in the case of those kids, they do have a legislated, there's a legislated duty in relation to their provision of healthcare that other kids wouldn't receive. But that made me wonder whether all children in detention may be considered to be, at least for that period, in the wards of the state, or to that or some equivalent under that act. So that may be where there may be something worth looking at there.
Yeah, great. That's really helpful. And yeah, if as I said, it's a work in progress, and so if anyone here has any other thoughts about what we may be missing or what else we should be looking at, then I'm more than happy to hear them and take them on board.
Great. A few more comments and questions in the chat. Neve is saying, disappointing to hear that WA doesn't have any requirements for youth justice healthcare. And Stuart is asking, as a next step for this program of work, have you considered looking at some of the downstream effects of the legislative policies, clinical guidelines, funding, health status of people in prison, etc.?
Yeah, definitely. I think next step, the initial project was going to be, legislation, policies, contracts, etc., and then realized, I looked at the contract between the Victorian government and for Ravenhall Prison, and I think I downloaded 850 pages, and I was like, okay, this is that's one private prison in one state. I think maybe we skip the policies for now and start with the legislation. But yeah, policies, contracts, potentially coronial inquests. They're all next steps, and probably also looking at, I guess, the models of care that governments have around Australia. And then, yeah, of course, like it would be great to be able to work out whether a higher standard that's legislated results in higher care. I think that's going to be really tricky to quantify and look at, but that would be amazing if that was something we're able to do, but definitely requires a lot more thought than I've given it at the moment.
Looking forward to seeing some of the results of the further work that's going to be done on this area. It's all very interesting. We have a question from Natasha. Are there actual definitions, markers in each state's requirements that could be used if someone wanted to measure alignment with these requirements, as in promoting health could be pretty easily claimed without actually doing much?
Not that I know of. There may be, but I think that's the main issue. There's, I can't remember how Victoria's is worded, but it's something, like reasonable steps for necessary care must be provided or something. And it's so vague. And there is case law about, people taking the government, trying to claim that they didn't, the reasonable steps weren't taken. And I think it's just so hard to prove because it's such a fuzzy word. And that's really the main issue here, I think. I think we need like clear, strong language, but also better methods of keeping government to account as well.
I have another comment here from Stuart. These findings seem highly relevant to the current Senate inquiry on youth detention and also to the work that CWLTH, sorry, I'm not familiar with that acronym.
Commonwealth.
Thank you. Commonwealth First Nations Healthcare in Prisons team are driving through NOWS and KPMG.
Yeah, I would agree with that. That works. I guess the first stuff I presented on around custodial healthcare governance is really important to that work, because it will be interesting to see. It seems like there will be, there's a big push for Aboriginal-led healthcare to be part of prisons and youth detention in Australia, which I think everybody agrees is a good idea. But it will be interesting to see how that plays out in the different models around the country. So when the difference between, a Department of Health having responsibility for healthcare as opposed to the Department of Justice having full responsibility in the current delivery of care, compared to, Department of Justice or Corrections contracting it out to private providers, for example. So it'll be, yeah, I'd love to see how that's going to play out across the different jurisdictions and what the best approach would be for that. Because we do have an ACHO in the ACT adult corrections already delivering some care, and that, is just one model. I think they deliver care alongside the broader public provider. But yeah, there's many different ways that could play out. Yeah.
Thank you, Darcy. We have John here saying, further to this Medline's question, I'm a physio working privately with Flight to Health as local public organization had too much work. Ryan is saying, certainly our inspections of Acacia Prison privately operated by Serco have found the provision of healthcare to be at a higher standard than public operated facilities, in part due to contractual obligations that are closely managed by the Department of Justice. I think this aligns with Louise was commenting before.
Yeah, that's great. Yeah, Ryan's the expert here, but that's great to hear. I've heard the same as Neve said, anecdotally, I've heard that, but yeah, that's great to hear that that's what you guys have found as well.
And Louise is further commenting here, I guess the government response in relation to these gaps is that the common law duties of care are present and govern the area. Although, of course, these aren't very transparent or easy to understand and can require court action to distill so far from ideal.
Yeah, I mean, again, this is getting into an area where, I'm not a lawyer and I'm not an expert, but I did one of Gabrielle Wolf's articles around Victoria's legislation around, just healthcare in adult prisons in Victoria has a whole section about common law duty of care as well, which I'll definitely go back and read up on a bit more.
We have Sean here in the chat as well saying, I wonder if human rights legislation in Queensland, Victoria, and ACT would provide prisoners a right of action against governments, noting that Queensland has a right to health under its Human Rights Act.
I would hope so. I would defer to the lawyers in our team around that. I'm sure there's case law out there that people have, tried to, well, I'm assuming that there would be case law around that. Hopefully it's the case, but yeah, I'm not sure. And we did deliberately exclude human rights acts or human rights charters, just to keep it a bit more contained, and it's, I guess, keep the interpretation a lot clearer, because I guess a lot of this stuff is down to the actual interpretation in a court of law, which is hard for us to quantify scientifically in our work. But yeah, sorry, I can't speak to that much. Sorry, Sean.
Awesome. Darcy, during this work, did you reach out to agencies and departments to confirm information? And also, do you have any sort of response that I'm assuming that agencies and departments in each jurisdiction would feel very strongly about their current arrangements of who provides health and who organizes the provision of health. Do you have any insights on that?
We haven't reached out to anyone specifically about this project. These still are preliminary results, and we've got a bit more coding and stuff to do. But yeah, it would be great to just run our findings by the different agencies in each state and territory, just to confirm that they have the same understanding that we do. It would be also great, to get thoughts from, in various states, the custodial inspectors and so on, because I'm sure this is an area that they're very familiar with. But not at this stage. But yeah, ideally we'll do that before we actually publish anything formally.